With that introduction, I'd like to move to the first panel of speakers. Um, the first speaker, Manda, has a very responsible position at Medtronic, which is, of course, a world leader in implantable medical devices and other therapeutics. He's responsible for Medtronic Ventures and new therapies, which puts him exactly at the cutting edge of new implantable devices for a company which has always been at the cutting edge of that field. And hence, I think it's really a great honor for me to have Ven lead off our session, because here's an individual responsible for the next decade in medicine at the company which has really created the past decade and is committed to creating the next decade as well. Ven is going to speak to us this morning on remotely monitoring chronic diseases, the role of the implantable devices. We could have no better individual addressing this topic. Please join me in giving a warm welcome to Dr. Manda.
Thank you, Dr. Rothblatt. One of the first things that happens with me is I have to adjust the mic down to the right altitude. So with that, well, thank you so much. I have the benefit of trying to keep you awake this morning, or the challenge, I should say, and I hope to do that. Just a couple of quick sentences. First of all, thank you to the co-chairs for inviting me to this meeting. This is the first time here for me. I think this is the first time anybody from Medtronic has actually joined this conference. I'm extremely excited. I have very little background, quite frankly, in the nanomedicine. I've spent about 15 some years in Medtronic, all the time working on implantable devices, pacemakers, defibrillators, and so forth. As many of you know, just to kind of let me spend about a minute or so on Medtronic itself. We have multiple businesses. Of late, in the last decade, however, we have branched out into more drug-device combination therapies. We have a neuromodulation division, which offers treatments for various conditions using a combination of devices and drugs. And right now, in my current role, which is I just started this, I'm one of many people at Medtronic who are thinking about where we need to be looking into for the future, and I think the expertise in this room will help me as well. But also, we are interested very much in looking at interventions beyond heart disease. We've got an active vision for trying to integrate micro devices with polymer depot drugs and various technologies we're using. In fact, our spinal division right now, the fastest growing segment there is in fact a bone morphogenic protein that is inserted into the cages for spinal fusion. So it's a diverse background. I feel very excited. This really energizes me. I like where I sit. And what I would like to do today is to, as Dr. Rothblatt mentioned, talk to you a little bit about the implantable devices and what role we think we can play in remotely managing disease. So let me, first of all, give you a disclaimer. This is my views, what you're going to hear about. I'm not going to be sharing with you what Medtronic thinks, which gives me some latitude, quite frankly. I don't need to be confined by corporate speak in this regard. But at the same time, it is probably consistent with where I think the company and in general our industry is heading. What I would like to do is to describe for you, just step back a little bit, and along the lines of what Dr. Rothblatt mentioned, discuss what is the role of telemedicine, and describe to you how disease management is defined currently. Perhaps give you a quick overview on trends in healthcare, in the healthcare sector. And then I would like to talk about how can we synthesize the pockets of understanding and assess the role of implantable devices. I'm going to forewarn you, this is not going to be a very technical presentation today. I chose not to get into the details of engineering today, which I would like to do, but I think what I'd like to step back and talk about is hopefully set the stage for the next day and a half on the convergence between disease management, i.e. telemanagement, and the importance of technology being part of the solution. So the agenda is as follows. Very quickly, I'm going to talk about what this means. Many of you know disease management, loosely speaking, is a system of coordinated healthcare interventions for populations in which self-care reports are significant. Now, this is today. This is how disease management is defined in various parts of the US, particularly. It's really supported by the practitioner and patient relationship. This is a very critical component of it. There is an emphasis on prevention, and the evaluation of outcomes is an ongoing basis. This is one of the key determinants. We don't consider ourselves to be in the disease management area. I get asked this question a lot: is Medtronic a disease management company? I've actually had the benefit of working with one of the luminaries here, with Dr. Bob Borge, over the last 6 years, and we've struggled, quite frankly, to figure out what role does a medical implantable device technology company play in disease management, because this is really the perspective of health plans. This is what insurance companies are interested in doing, and unfortunately, disease management is today, in my view, limited primarily to cost containment. I don't think it really does justice to improving quality of care or outcomes. So that is where I hope that I think the future role of telemedicine can play a big important role. These are the large disease states that are targeted right now in various parts of the healthcare systems, not only in the US, but also internationally, even in the European guidelines. Diabetes, congestive heart failure, obstructive pulmonary disease, coronary artery disease, and so on. These are fairly chronic diseases, fairly debilitating conditions. Notice that cancer is not part of this mix right now, which is unfortunate, but I think it should be. And part of that has to do with, I think, the disparate nature of research that is taking place in cancer as well. Let me just quickly overview the model that exists today, and I'll sort of paint a picture of how I think it's going to what we'd like to see it evolve towards in the future. So if you look at starting with the process, step one in the process of this telemedicine or remote management, I use these terminologies somewhat synonymously. I admit that there are probably different interpretations of this, but I think the end goal here is to improve outcomes. So first step is patient identification. And then the second step is assessing the patient. This is what happens in the setting of a health plan or in the setting of a hospital or a delivery system. And then there's a stratification of individual patients into various risk factors or various risk categories. And remote monitoring is now emerged as a vehicle for connecting the two, between patient assessment and identifying risk factors, and then continuing to screen the patients for future characterization of risk. Now, in the role that we see from an implantable standpoint, for example, this is hypothetically chosen. Let's imagine there's a risk stratification that's provided as a high-level risk for a given patient group. What we see happening here is a sort of convergence of interesting ex vivo non-implanted devices today that are being utilized. So whether it's a blood pressure cuff, whether it's a glucometer in the patient's house, or it's weights and scales, these are typically used in monitoring patients right now. In fact, there's a large companies like American Health Systems that are doing this routinely. This is not what we do, but this is what we're measured against. And quite frankly, what's involved here is a phone call to patient and then some directions to see a doctor. Routinely, this is the system. When you look at the role that implanted devices play, we actually, quite frankly, don't play a big role right now, even though this is one of the most expensive sectors in the healthcare field. Implanted devices I'm talking about. We don't have a real good footing in this cascade of disease states, whether it's coronary artery disease, congestive heart failure, or hypertension. That's not necessarily the model. It's mostly based on physical signs and symptoms, medications, diet, and compliance issues. So what we'd like to see happen here is, I'm going to move through this a little bit faster because there's too much animation here, is that what we'd like to provide right now is objective data. Unfortunately, one of the things that we see is that the system today for telemedicine is, while it's okay, as I think Dr. Rothblatt pointed out in the beginning, the desire for precision is not, even though it's there, the ability to get precision is completely lacking. There are no physiologic markers. It's usually interventions after the patient's symptomatic and things like that. So we think the number one contribution we can provide with an implanted device or sensors is objective data and timely data as well. So the future that I see using this simple cartoon is that we want to be part of the puzzle and fit right in with the model that's there. We don't see an implanted devices as being unique by themselves. They have to fit in with the existing model with patients' behavior changes, signs and symptoms, and external measures as well. So, and these are the last couple of slides I'm going to talk to you about trends, and then I'm going to dive into devices themselves. One important statistic that kind of struck us is that, at least if you look at the US population, the number of Americans that are going to be 65 and older is going in the next, this is in the next decade, is going to increase by 52%. And so this has a significant impact right now in the consumption of healthcare dollars as a proportion of GDP. I'm actually extremely pleased that we actually have a president who can intelligently articulate now the need for having a honest conversation about what is the meaningful ways in which we can control this. Now, and I think I can be more, as a healthcare economist after my biology training and I wandered into various different fields, I actually tried to understand this from the inside out. And I was struck by this, that there's a complete lack of understanding. So I think we have a guy, at least in the US, who gets it. And I can be enthused, even as a medical device company. So we talked about advanced medical home. This is one of the things that we are very interested in is, how do you set up the future with advanced home? We just talked about how these body area networks can help enable some of these integrated systems that are somewhat disparate to come together. But the American College of Physicians actually had a nice quote that I thought was very instructive for me, and that is to acknowledge that the best quality of care is provided not in episodic, illness-oriented, complaint-based care, but through patient-centered, physician-guided, cost-efficient, longitudinal care. I think this really is, this may be a holy grail, and I suspect there's a lot of landmines along the way, but this is really a noble goal for us to go after. So if you look at the advanced medical home, what it really entails is organizing the delivery of care using evidence-based medicine and access. That's the most important thing. Some of our sickest patients don't have access to advanced technology. And I think one of the things that we think we could do is make this simple enough that even the sicker patients can get easy access to this. I'm not going to belabor you with the demonstration projects. The reason this is of interest to a medical device company is because ultimately this is a lot of heavy lifting. This is not an area, telemedicine is not something that the traditional implantable device companies are good at doing. We're not a Microsoft, we're not any of the large information technology companies. So it's really important to us to understand where the health plans, particularly institutes like Medicare, are investing their energy into. And I can assure you that this is a very interesting field for large company, for large health plans like Medicare in the US. I know this is true in the UK with the National Health Service there, as well as in Europe as well. So let me move now to my comfort zone and talking about how does this all boil down to implantable devices. So when we think about implantable devices, there's a lot of companies, and Jay Yadav is going to get up and talk about his own company as well. But there are many companies in this field that are starting to get more comfortable with this technology. 20 years ago, it was very difficult for a startup company to overcome the barriers to entry in this space because of the capacitor technology, batteries, hermetically making it last for 15 years, not only from a patent standpoint, just from the basic know-how. I don't think those barriers exist today. There's a lot of smart people in the world, and they're all so while I have 4 companies listed here, I want to show you a little bit about, do some justice to the fact that there are other companies beyond Medtronic that are looking at this field, and they're all interested in trying to figure out what role we can play in disease management. So I thought I'd point out one important, and this is actually a fairly neat solution that Boston Scientific has come up with. They have a system called Latitude, and what it contains really is a wireless in-home monitoring system that sort of integrates on the left-hand side on the graphic here, you see the scale, blood pressure, and the implanted device over here. This is how our devices look as well. But bottom line is, what they do is they transmit all this data into that central home unit here, and then this is then transmitted over to a central server, which then people can watch. There is a call center that monitors the data and then integrates the information from the patient to the appropriate care provider. So let me jump into what Medtronic does in the field of telemedicine as we know it and define it. And that is, telemedicine to me is being able to remotely access a patient's healthcare information in its simplest definition. And we from our prism, admittedly this is a myopic viewpoint because we're looking at the world from the point of view of a patient who has an implanted device. We actually have the largest network of patients who have an implanted device, who have access to a remote telemedical system, if you will. It's called CareLink, this network. We consider this to be a gold standard. I don't mean to be biased, but it is, in large part because there are a lot of issues with this. As you can imagine, there's data privacy issues, there's access, there's compliance regulations that govern this. But right now, we have almost 200,000 patients since this slide was put together in the last fall. We are in about 2,000 clinics in the worldwide, 1,700 in the U.S. We are connected to a vast majority of Medtronic's devices now. Patients get access to a home Unither, home monitor. That's what this is right here. You see this? This is a simple unit that this now has a wand, which is a telemetry head. But in today's generation, there is no telemetry head. There's a wireless device that transmits the data to the patients, to the clinic. This is how the network looks, if you will. The patient's data can be viewed on a CareLink network in a system, and a physician can log on, and they can see the patient's data. We also have some alerts. For example, on the right-hand side of the chart, what you see here are some graphics. The implanted device store a lot of information. There's a memory set. There's so this information is periodically transmitted, and clinicians can actually see this information. Bob will give you more details on one particular example, but these are trends that are quite useful for physicians in troubleshooting not only the device but also to alert the physician about some changes in the underlying substrate. So let me just keep moving on for the. Oops, there we go. Now let me just talk a bit about some basic, one example of a device that sort of fits into the sweet spot between telemedicine and potentially nanomedicine, although it's not quite as small as we'd like it to be, is this notion of monitoring heart failure. I think other speakers are going to talk about pressure monitoring. I'm going to talk to you about how we've used an existing technology. As many of you know, defibrillators and pacemakers have hardwire. There's a pulse generator, and then there's a lead, a conductor that goes into the heart, which generates a stimulus to sort of capture the heart. What we've done is use the basic core technology that exists in those devices and looked at the impedance between the various vectors. So in this case, the impedance between the electrodes in the right ventricle of the heart, and then this is a can. The can itself is active. So the surface of the pulse generator itself is an electrode. So we can measure the impedance across this, and that's an indication of changes in fluid status. In fact, what is well known is that the tissue resistivity, for instance, is different based on kind of fluid you're talking about. So in the case of fluid, it's about 40 ohms per centimeter, 40 ohm centimeters, and all the way to air, which is a positive infinity. So one thing, and we can use this basic property to determine changes in underlying physiology. So for instance, we can look up here in these devices, we can monitor what's called changes in fluid status. And this is a surrogate. It's not as good as pressure monitoring, but for a patient who's already had an existing device, this is a useful information to provide as a signal. And it's been validated against pressure monitoring to show that changes in impedance. So when the fluid builds up in the patients, their impedance drops dramatically. And that change in impedance can be a signal of impending congestion that can then trigger patients through the physicians for action when the data is transmitted to a remote website. That's what the system enables. And I've shown you here some examples of all the things that we try to monitor with these devices. So we can monitor heart rate, what's happening are they having an arrhythmia? If so, what's the ventricular rate during the arrhythmia? Are they getting a therapy? The CRT is a life-saving therapy in some patients. Sometimes when devices don't pace, the patients can be hurt. Are the patients decompensating? Is the fluid index rising? So these are all kind of sort of the markers that we send as part of the disease management portfolio for these patients. We can also try to understand what happens around the instances where patients have a very fast ventricular rate. A tachycardia is where a patient has very heart rate goes up above 200 beats a minute, for instance. And it turns out there are some patterns even before a patient gets there in looking at the underlying changes in signals and what happens. Now, I mentioned earlier, so the convergence of this here, what the point of this of those two slides was to show you that as we look at telemedicine and the role of telemedicine, is to be able to take these what we think are extremely valuable physiologic signals and to be able to get it timely to a clinician. And in this role, the telemetry, and I think that one of the speakers is going to talk about various telemetry schemes and body error networking, is a very important part. Without that, there's no point in having all these fancy sensors if we can't get the data out in the right time frame. So what we have now is what you see here is a wireless telemetry system where in our devices now transmit without any patient being involved remotely to a home unit, which then communicates to a website, and then depending on the choices that a physician picks, that data can be immediately transmitted to a clinic or a physician's pager, and so on and so forth. So you'll hear more about heart failure sensors. We're not the only ones in the space, as I mentioned, and I'm not going to get into this detail. But and I think Dr. Borge will go over the Chronicle system, which is quite dear to my heart as well. I spent the last 6 years working on this, which is very useful in patients with heart failure, pulmonary hypertension, and so on and so forth. So let me conclude then with the following observations, and I kind of jumped through some of my slides, and forgive me for that. But suffice it to say that I don't think this idea of disease management is new to Medtronic, certainly not new to our industry. We think that the telemedicine and remote disease management, I think, signals movement to holistic patient care. When I joined Medtronic, the company, we had no idea how to even remotely manage our patients. We had dedicated pacemaker clinics set up everywhere in the country, and patients had to come to those pacemaker clinics. Today, it's a different world. We actually have a large website, and we take care of the telemedically obtained data, in a remote center. We think that implanted devices can play a role in providing physiologic signals. However, clinical evidence is going to be very crucial for the adoption of these technologies. Finally, I think the future emphasis is going to be on the convergence of these miniature devices. As we speak today, not only are companies here and ideas here being discussed, even back home in Medtronic, we're working on extremely nanoscale, picoscale technologies, particularly to close the loop in terms of sensing and treating at the same time, and with the advances in long-range telemetry and prevention. So with that, I hope I just have given you some insight as to how a large medical device company is looking at this for the future, and I look forward to learning more, quite frankly, than I probably shared with you for the rest of the day in terms of what you have to say. So thank you.
Thank you, Bon, very much for that was a great presentation. And we have time for 1 or 2 questions to Ven before we move on to the next speaker. Are there any questions with regard to either Ven's vision moving forward of chronic telemetered disease monitoring? Yes, in the back. If you could introduce your name to start, then it will be helpful for the streaming video on the web.
Hi, Melanie Swan. I was just wondering if patients can themselves log into the CareLink network or be an active part of their own monitoring.
It's a great question. There is a patient web page that they can access. It's not very interactive. It doesn't allow them to change the parameters on the device, but they can look at their basic, for example, one of the things that's very interesting right now for patients is how much battery life is there in my device. Okay. So there is and I think that's something that they can access, but it's not something that we've been able to advance nearly as much as the clinician part of the data. But that is something we're expecting to go, though. There is one other part that I forgot to mention, and many of our devices have what's called a patient activating system. So there is a handheld device the patient can carry with them everywhere. They place the handheld device on top of the device, on their implanted device, and interrogate it, and they can get some validation of device status. So I know that in the EMR space, there's as you can probably imagine, I know that Centricity probably has this as well. You have I think it's called MyCharts. You can access patient data. We're not quite there yet.
Great. One more question for Ven? Yes, please introduce your name and affiliation if you feel comfortable.
Simon Benita, Hebrew University of Jerusalem. I wondered it's very interesting in disease management if you are inserting in your equations the disease treatment of a different drugs.
Right. So I think this is interesting. Right now, we don't do a good job of getting the comprehensive information on the patient, on the drug piece, on their medical management. We do have certain websites where you can make notes and annotations about changes in medications, but quite frankly, we don't have that yet. That's part of that's why I said, the vision is to become more integrated. We're not quite there yet.
Okay. Thank you.
Thank you very much.
Thanks.
Thanks.